This is based on the China Military Institute discovered and owned some bad coronavirus named ZC45 and ZXC21. Based on that, after lab modification, becomes the novel virus.
So, sorry, Dr. Dr. Gian, if I may interrupt just a second.
Why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China.
On this video, we will discuss about the origin of COVID-19. Many health experts believe that the new strain of coronavirus perhaps originated in bats or pangolins. The first transmission to humans was in Wuhan, China. Since then, the virus has mostly spread through person-to-person contact. First COVID-19 case was traced on a 55-year-old individual from Hubei province in China on November 17, 2019. Many people eventually took part in Lunar New Year, and when they returned their own country, and with this they spread COVID-19 in their country, and sooner it turned into an epidemic. Another theory is that Wuhan market was the epicenter of COVID-19, and some experts believe that COVID-19 spread from Wuhan lab, because China has the Asia's biggest virus bank in Wuhan city. COVID-19 may have leaked from the lab in Wuhan. Let me be clear, the Wuhan lab can play a role for the epidemic that we all are suffering from until now. Coronavirus is a group of viruses that can cause disease in both animals and humans. The virus strain known as SARS coronavirus is an example of a coronavirus. SARS spread rapidly in 2002 to 2003. The new coronavirus had spread rapidly in many parts of the world. On March 11, 2020, the World Health Organization declared COVID-19 a pandemic. A pandemic occurs when a disease that people are not immune to spreads across large regions. Total active cases worldwide 150 millions, and approximately 90 million people were recovered, and overall death more than 3 millions. USA is leading on the list with 32 millions of affected people and death 500,000 people until now, and India is not too far on the list. Since few weeks, active cases of COVID-19 had increased drastically. Every day, approximately 400,000 people are getting affected due to COVID-19 in India, which is a record itself. In rural areas, shortage of beds, lack of proper infrastructure, lack of proper medical facilities is bringing more trouble in people's life during COVID-19 crisis. In Africa, more than 250 million people are facing food crisis. After COVID-19 spread all over the region, it made things even worse. Africa is second most undernourished continent after Asia, according to FAO. Sub-Saharan Africa is affected the most. COVID-19 has exacerbated the food insecurity further. We have already made a separate video about this topic. You can check it out. 114 million people lost their jobs during COVID-19 pandemic, and eventually it moved 124 million people under extreme poverty level. Although many countries have come forward to help India amid COVID crisis across the country. These countries are Singapore, UAE, Saudi Arabia, Israel, Russia, France, UK, United States of America, and etc. Those with the most potentially concerning are called variants of concern and kept under the closest watch by health officials. The UK or Kent variant is prevalent in Britain but has spread to more than 50 countries and appears to be mutating again. The South Africa variant has been identified in at least 20 other countries. The Brazil variant has spread to more than 10 countries around the world. To prevent COVID-19, our government should vaccinate each and every people as soon as faster. There are so many vaccines available in the world, such as Covishield, Covaxin, Pfizer, Sputnik, Moderna, Johnson & Johnson, and Chinese Covax. But the efficiency of these vaccines are different from each other. We will make a separate video about this topic if you comment below. Despite people are suffering across the country, daily active cases are on its peak. But still there is a hope that we can fight against this invisible enemy. You can also give your contribution on PM Cares Fund and through other methods as well. If you cannot contribute through financially, then you can follow few steps. Wash your hand regularly, avoid crowded place, use sanitizer, use mask even outside and even if you are at home, and register yourself for vaccination drive. Let's protect each other, let's fight against this invisible silent killer. Please stay healthy, stay safe and stay at home. I hope this situation ends as soon as possible so that we can come back to normal days as before. PM Cares Fund link is on the description and on the first comment on. Please help me to reach this message to thousands of people, not for views, not for subscribers, but for humanity. Share this video as much as you can so that we can make more people aware about this virus.